It's an ability that most of us likely don't appreciate enough, the ability to hear clearly. According to the Colorado Commission for the Deaf and Hard of Hearing, more than 758,000 Coloradans are estimated to be either deaf or hard of hearing. And nationwide, 1 in 8 people aged 12 and older has a hearing loss in both ears. Now, most people with hearing loss, however, don't seek treatment for one reason or another.
Well, now the FDA is working to remove some of the barriers for people with mild to moderate hearing loss by allowing the purchase of over-the-counter hearing aids.
As Denver 7's Megan Lopez explains, there is some mixed reaction to the news.
I've always had hearing issues, significant hearing loss in the higher registers.
For a long time, Kurt Sevitz knew there were things he just couldn't hear.
So I can't hear a lot of high-pitched noises.
But until 4 years ago, he couldn't afford to buy hearing aids. He'd need to pay about $5,000 out of pocket.
A lot of insurance plans don't cover them, especially for adults.
So he saved up for years, went to an audiologist, and got a prescription.
I have been able to hear noises that I didn't even realize I wasn't hearing.
Kurt isn't alone. Audiologists believe only about a quarter of people with hearing loss get help. Money is a definite barrier. So this week, the FDA finalized rules to allow over-the-counter hearing aids for people with mild to moderate hearing loss.
We are excited about this FDA announcement. It has been a long time coming.
Wynn Wyman says the new rules give her hope that more people will access hearing aids and the costs will drop.
We're hoping that this will shake up the market and will create a continuum so that people can figure out their match.
Over at the Marion Downs Center, though,
there are many different types, sizes, shapes.
Dr. Sandra Gabbard is more cautious in her optimism. Already she's gotten a lot of calls from patients wanting to know what this means for them.
And I think one of the biggest challenges for everybody, the customer, audiologists, people in hearing healthcare, is going to be how do people accurately self-identify?
The FDA ruling doesn't apply to kids under 18, people with severe or profound hearing loss, or those who are deaf. And there are downsides to people getting hearing aids without a prescription.
And I think part of the harm might be from missing a medical condition. The second thing is, could the device cause harm?
If they turn it up too loud, for instance. Still, Sandra's hopeful.
This is an opportunity to be a good entry-level type of product for people that have been putting off getting help.
As for Kurt, he says he would have tried this option while he saved up.
I really hope it kind of gets the conversation going about hearing aids and coverage for them and how challenging it can be to get them.
For now, he's just grateful to be able to hear. Megan Lopez, Denver 7.